Good afternoon. Today we're going to talk about infectious agent dengue fever. So what is dengue fever? It is a mosquito-borne virus generally affecting people in tropical and subtropical areas. Though more rare, outbreaks have been seen in Europe and the United States. The number of dengue cases reported by the World Health Organization increased over eightfold over the last 2 decades. Reported deaths from the year 2000 to 2015 increased from 960 to 4,032, affecting mostly a younger age group. Spread via mosquito bites, no person-to-person transmission, except for perinatal transmission. Mild dengue fever causes a high fever and flu-like symptoms, and the severe form of dengue fever, also called dengue hemorrhagic fever, can cause serious bleeding, a sudden drop in blood pressure or shock, and even death. Risk factors include living in tropical or subtropical areas of the world, particularly in Southeast Asia, the Western Pacific Islands, Latin America, or Africa. Increased risk to those that live in areas or work or spend a lot of time outdoors in those areas. Having a history of dengue fever infection, so past infection, even if it was mild, increases the chance of future infection being more severe. Women who get dengue fever during pregnancy may be able to spread the virus to the baby during childbirth. Rare cases of transmission via blood products, organ donation, and transfusions have been noted. Other social and environmental risk factors include urbanization, population density, mobility of populations, water storage practices, and attitudes towards infection risk factors. So the symptoms of mild dengue fever are severe headache, pain behind the eyes, muscle and joint pains, nausea, vomiting, swollen glands, rash, and this will always be accompanied by high fever, usually over 104 degrees Fahrenheit. Severe dengue fever is also typically accompanied by severe abdominal pain, persistent vomiting, rapid breathing, bleeding gums or from the nose, fatigue, restlessness, liver enlargement, or blood in the vomit or stool. Infection, an estimated 40 to 80% of infections are asymptomatic. About 5% develop severe life-threatening infection. Dengue begins abruptly after an incubation period of 5 to 7 days, with a range of 3 to 10 days. The fever typically lasts 2 to 7 days and can be biphasic. Dengue fever virus patients are not contagious. Testing, consider whether the patient was in an endemic area within 2 weeks of symptoms. Nationally notifiable disease, so all suspected cases should be reported to a state or local health department. Laboratory confirmation can be made early in the disease with an RT-PCR test or an NS1 antigen test. Later in the illness, IgM tests can be detected with ELISA, which is enzyme-linked immunoassay, which detects antibodies. Patients should stay well hydrated and avoid aspirin or other NSAIDs because of their anticoagulant properties. Fever should be controlled with acetaminophen and tepid sponge baths. Most improve within a few weeks. There is no specific treatment for dengue or severe dengue. Early detection of severe dengue and access to proper medical care lowers fatality rates of severe dengue to below 1%. Since there is no treatment for dengue fever, early detection for symptom management and prevention of the disease is key. The risk to healthcare workers is insignificant as dengue fever is not contagious from person to person. Normal day-to-day precautions and cleaning protocols may be used. The first dengue vaccine, Dengvaxia, was licensed in December of 2015 and has now been approved in about 20 countries. Analysis showed that a subset of trial participants who were inferred to be seronegative at the time of first vaccination had a higher risk of more severe dengue compared to unvaccinated patients. As such, use of this vaccine is targeted for persons living in endemic areas, 9 to 45 years of age, who have had at least one episode of dengue virus infection in the past. Several additional vaccine candidates are now under evaluation. Preventative measures are the best defense against dengue fever. These include GIS mapping to locate dengue concentrations and control the vectors to mosquitoes. Education strategies on proper mosquito prevention, sprays, limited outdoor activity in high-risk areas, and community strategies, including destroying vector habitats and the use of insecticides. These are the references to give credit for where some of this information has come from. And thank you very much. This is my contact information if you would like to reach out or have any questions to follow up on.